Hello, everyone. I would like to introduce you all to a DSM 5, um, our diagnostic and statistical manual for mental disorders. This particular disorder is actually called excoriation skin picking disorder, or you can also call it dermatillomania, whichever you prefer. However, this skin picking disorder entails one repetitively scratching or picking or digging in their skin, whether it be with an object around the house, their fingertips, whichever they can use to satisfy their need to do so. This disorder was first deemed the term neurotic excoriation in 1875 by Erasmus Wilson. Some of the symptoms of this disorder is skin damages, camouflages via makeup. They just vary from skin lesions and much more or less. It all pretty much depends on the individual. The prevalence of this skin picking disorder is about 2 to 5% of population actually picks their skin, 75% of which are female, and this actual disorder is a functional impairment. Some causes of this disorder, or it may have the individual feel like they're relieving stress. There may be some other underlying psychopathological issues. They just basically could be mild to severe. It all depends on the individual again. And some treatments are interventions, medications, which it could pretty much be broken down into three major therapeutic processes. One, CBT, which of course we're familiar with, the cognitive behavior therapy. And then there is HRT, the habit reversal training. And last, the acceptance and commitment therapy. Some outcomes from which are, instead of picking the skin in the therapy, the patient will find other ways to execute that energy, spend their time maybe grabbing a stress ball in a time they feel like they would usually be wanting to pick their face. Through the patient's full commitments and willingness to want these habits to vanish, they would actually have to have dire need and a desire to stop. I feel that this is a minor yet gateway disorder. It all depends on the person. I do know, like, sometimes you may say, or you may see people that, like, with drug addictions, they actually pick their skin. Heroin addicts, I can say that would be some form where you may have a lesion, so I've researched. But a lot of this information I've also discussed was in New York Times Journal and our American Psychiatric Association webpage. So just feel free to do further research and inform yourself. Thank you.